Hello, and welcome to the Care Machine Sustainable Healthcare Podcast. I'm your host, Professor Helen Mees. Now, despite the all-consuming mission of the global healthcare sector to do no harm and protect society from illness, disease and death, it is, according to NGO Healthcare Without Harm, the fifth largest emitter of global greenhouse gases on the planet. Indeed, healthcare's climate footprint is estimated to be 4.4% of global net emissions. That's equivalent to the output of 514 coal-fired power stations, making it comparable in significance to the food sector in terms of climate impact. It seems ludicrous then to think that the act of caring for those suffering from health conditions brought about by climate change is partially responsible for their condition in the first place. It's quite clear then that the healthcare sector, both clinical and technological, must address their alarming contribution to the climate crisis. A two-pronged approach is needed, one which treats those made ill, injured or dying from the climate crisis, and the second which drastically reduces its own innate contribution. Many of the leading global healthcare companies and health service providers are already implementing sweeping changes, and here in the UK, the NHS is leading the way. The paradox for the NHS is that while it accounts for around 5% of the country's carbon emissions, it also provides over 7% of the UK's GDP, buying in goods and services from over 80,000 suppliers. Recognising its responsibility, in 2020, the NHS became the first national health system in the world to commit to delivering a net zero service by 2040 through its Greener NHS initiative. To achieve this, it will not only have to change the way it cares for patients across the hospital network by opting to use more sustainable methods of treatment, but it will have to radically transform the way it selects and uses products and services, driving change across its entire supply chain network. The NHS and other global healthcare organisations cannot make these changes alone. Engineering will and is playing a significant role in improving care provision and in developing the technology that clinicians use. It is then engineering that will drive the development and adoption of sustainable and green technology alternatives for the healthcare sector going forward. In this first Sustainable Healthcare episode, I speak with guests Rachel Stancliffe and Elaine Mulcahy about sustainability, why we should care about it, what the future holds for sustainable healthcare, and how we can make a difference in our everyday lives. Rachel Stancliffe is the founder and director of the Centre for Sustainable Healthcare, CSH. She has a human sciences degree from Oxford and a master's degree in demography and entomology from the London School of Economics. She has worked in public health initiatives in the UK, Georgia and Kazakhstan before helping to develop the Cochrane Library. The Centre for Sustainable Healthcare helps the NHS and other health systems to reduce carbon emissions and increase sustainability. It's one of the foremost institutions in the world working on sustainable healthcare in research and practice. Elaine Mulcahy is the director of the UK Health Alliance on Climate Change, which is an alliance of 54 UK-based health organisations with a shared vision for a sustainable, just and healthy world. She has a PhD in bioengineering from the University of Strathclyde and completed postdoctoral research in neuropsychology at the University of Sydney and Australian National University. She has extensive experience in working in health and science communications, organisational development and strategic leadership roles. She's written several publications on the intersection between nature, climate change and health. Under her leadership, the Alliance brings together health professionals to advocate for climate and ecological crises and empowers its members and healthcare professionals to make changes to their professional and personal lives to respond to these challenges. I began by asking Rachel, what is sustainable healthcare all about? Rachel, thank you so much for being one of my first guests on the Care Machine podcast. It is wonderful to have you on our Sustainable Healthcare episode.
Hi, Helen. Lovely to see you again.
Today is all about setting the scene in terms of what is sustainable healthcare and why it is so important, not just to people like us in the sector, scientists, engineers, and clinicians, but why it's important to patients as well. But before we get into that, I wanted to talk a little bit about the Centre for Sustainable Healthcare, which you co-founded back in 2008. Can you tell us a little bit about how that came into being and what were the drivers for its inception?
Yes, thanks very much, Helen. Well, at 2008, I was working away in evidence-based medicine, and I had been a greenie when I was a teenager, and I sort of reconnected with environmental work and found out what was happening with climate change. And I was so worried. I started having nightmares, literally having really bad nightmares about flooding and refugees and things. So I knew I had to do something, and I wanted to see what was happening already in healthcare. So I had a look around, and there wasn't anything visible happening at all at that point. So in response to that lack of work on sustainability in the NHS, I connected with Sir Muir Gray, who I'd done some work with before already, and I started the campaign for greener healthcare with him. And that brought together experts in medicine, public health, research, environmental consultancy to begin to galvanise action. Many people at the time were still not aware of the problems of the human impact on the environment, and we had to do a lot of persuading of those working in healthcare that there were links between health and climate change, which seems hard to believe. But because we saw the urgency of this need for kind of like big, rapid change in the system, and also sustainable healthcare was kind of entirely new, we knew that there was a huge amount of work to do. So we were simultaneously persuading people that this was a problem and there was a need for this, defining what it was, and also developing programs to support it. So I guess just then, sustainability organisations who'd worked in kind of other sectors were beginning to look at healthcare. But they were focused on infrastructure, energy, recycling, basically. And we understood from having worked in the health system ourselves, this wasn't the heart of healthcare. So installing new boilers, changing light bulbs, putting in new recycling bins wasn't going to get us as far as we needed. It was helpful, but it wasn't enough. And so without engaging the healthcare professionals and the patients, any efforts to make the system truly sustainable were going to be impossible. And the first carbon footprint of the NHS was published very soon after we started. And it showed that the buildings and energy kind of bit of the footprint was only responsible for about 20% of the whole. Another 15% was on travel, and the rest, mainly pharmaceuticals and medical devices, were directly influenced by the care and the way that it was given to patients. So that's why we started and how we started working as we did, which was very much to inspire people with the need for change, to adopt, different approaches and integrate sustainability, to empower both professionals and others in the system with the knowledge and the resources they needed to do that in order to transform the healthcare system, which was going to be better for both people and the planet.
You were right at the cutting edge of it then, really, weren't you? I mean, this is well before the NHS were thinking about the Green Initiative and other things. You were really pushing the boundaries at that point.
Well, it was interesting because there was nothing visible at all happening. But actually, I went in 2008, I went to a meeting at the Royal College of Physicians, and I met David Pension, who was the very new head of the Sustainable Development Unit, which was the kind of very, very small unit, which was the precursor to the Greener NHS. And he'd just been put in place by somebody in the east of England. So they were sitting within a region within England, but that was the beginning of. So in fact, we started at exactly the same year, but we didn't know about one another. And maybe if I'd known that he was starting, I wouldn't have started.
Well, maybe it was fortuitous that you didn't know and that you were able to set up the Centre for Sustainable Healthcare, and the work that you've done since then obviously has contributed massively to the whole drive for sustainability. So maybe it was a good thing. I guess because this is the first episode, we want to talk a little bit about the basics, all right? A few definitions, if you like. So what exactly is sustainable healthcare? And how would you define it? Because this is not a one-size-fits-all title, is it really?
No, certainly not. And there are lots of definitions. So we think about sustainable healthcare as meeting the needs of our populations without damaging the health or ability to meet the healthcare needs of vulnerable people now or in the future. Very simply. So it's a kind of addition to the UN Sustainable Development definition. It's a kind of extension of that, or a specialization of that, I guess. And we can work towards healthcare by improving sustainable value. And so that for us is part of the definition. So sustainable value is about maximizing positive health outcomes for not just individuals, populations, by reducing inequity while minimizing negative environmental, financial, and social impacts. So that's our kind of triple bottom line equation that we talk about. So fundamentally, sustainable healthcare is good healthcare.
To us, it seems pretty obvious, right? You know, as an engineer, I want to build sustainability into the products that I create or develop, the methodologies that I work on, but it's not common sense to everyone. And so this is something that I suppose you as an organization are really working towards to help people understand that definition and how it applies to them.
As you say, it's not obvious. We have assumed that the things that we do in healthcare are always good, and they were done with good intentions, or nearly always. But obviously, we've discovered that not only are we part of a system on which we depend, which is being damaged by various things, but also healthcare contributes to that. So that's the kind of double understanding that we need to have, that we need to help people to have. And obviously, different players in the system have different viewpoints on that. And some people will come in and say, well, that shouldn't be us. We shouldn't be having to worry about that. But my view is that if we don't all worry about it, it's not going to happen. And actually, we'll come back to this, I'm sure. As I've said, sustainable healthcare is good healthcare. It's not just important for the planet. These are things which are entirely better for people, not just in their position within the sort of environmental limits, but also for healthcare per se, just better healthcare. So it's kind of no-brainer.
It is, yeah, it is. We should remind our audience as well that if we put all of the healthcare organisations together in the globe and all the people that are making medical devices and technology in this sector, we are the 5th biggest polluter on the planet, right? We're 4% of the global CO2 footprint, which is a huge impact. I think the data is that we sit somewhere between Russia and Japan in terms of our contribution to CO2.
Yeah, it's massive, isn't it? And that's because we spend quite a lot of money, resource on healthcare because we need it. It's a totally fundamental part of humans' lives. We'll always will need it. And although, again, we'll come back to how we can minimize what we need, it's not going to go away. And so it's always going to be a big part. And so making that as green as possible is really important. And, when we look at our footprints, we need to decrease our footprints by 80-90%? That's a lot.
And that sort of leads on really to my next question, although I think we've answered it a bit there. Why do you feel sustainability needs to play such an important role in health and care today?
Yeah, we have sort of touched on it. So basically, our health depends on natural systems, which provides, a stable environment, air, water, food, and other ingredients that are essential for healthy life. And the global climate and nature crisis is a health crisis. So, we are in a crisis which is not of healthcare's making, but that will affect everybody, is affecting people's health in many places already. And then the second part of that is that healthcare is part of the problem, as you alluded to before with your percentage. So in order to be sustainable, healthcare systems must not only look after their workforce and spend wisely, they must stop harming nature and keep within environmental limits. So yeah, there's that twofold thing of healthcare looking after humans, which are part of the planet, and also healthcare damaging the planet or contributing to damaging the planet, on which we all depend. So yeah, I mean, sustainability, therefore, it's not that it plays a role necessarily, but it needs to be integrated. It needs to be part of how
Yeah.
we just think, or we shouldn't even think about it. It should just be embedded in those systems so we don't have to think about it.
Absolutely. That's something that I talk about, that this should be part of our lived experience, that we should be embedding this into everything that we do. We shouldn't have to think about it as a plug-in or an afterthought. It should be a fundamental part of how we develop healthcare, how we look after patients, and that should be our bottom line, right? So yeah, I'm totally with you on that one. Some of my later episodes of this podcast, I'm planning to unpack the challenges of implementing sustainable practices, particularly in the NHS, with some of my guests. But from your point of view and that of the work of CSH, how important is it to embed sustainable thinking into our healthcare services? And is this unique to the NHS, or is this something other healthcare providers are attempting to undertake?
Okay, so firstly, yeah, of course, it's absolutely vital, as we just said. And I think so, alongside kind of advocating for change. So part of this is about pushing for the understanding that it's really important. We've been mainly focusing on our sort of efforts on supporting people to make change in very practical ways. So a lot of that is because we're small, we've always been small, and there is so much to do. It's not that we can come up with all the solutions. So it's about identifying strategic levers in the system that would enable sustainability to be embedded. So, you know, in a system as large and complex as the NHS, we knew that in order to make lasting change, we need to work really closely with people in different parts of the system on how those changes would happen, rather than not just, you know, saying what should happen. This must happen. This should happen. We've got to reduce. It's like, okay, that's a set of, you know, maybe useful documents that might be sort of galvanize people into action, but actually people need to know what to do and how to do it. And I guess we also realized early on that in this sort of, it was such a new field, really. There wasn't sustainable healthcare before. To find solutions, we'd need to collaborate with loads and loads of different stakeholders, patients and practitioners, NHS leaders, journal editors, researchers, industry, you name it. So it's always been a very big collective effort about, you know, understanding what needs to happen, how that can happen, and not just coming up with solutions from the outside. To achieve transformation, when you have to inspire people within the system and give them knowledge and tools to make those changes. And I think our work very quickly demonstrated that sustainable healthcare was also aligned with better outcomes for patients and also saved money. So again, we're back to this triple bottom line of it's necessary, but it's also better. So the other part of your question was about bringing it to other places. So whether it wasn't just NHS, and it's definitely not just the NHS. I mean, it's interesting. We always think we're struggling in this country, but for years, you know, when we have been abroad or talked to people from different countries, we know that the UK is kind of held up as a beacon of sustainability in healthcare. It's partly to do with the work of the government and lots of people within the system. So basically, you know, we've worked with people in health systems in Australia, in Canada. We're beginning to share a lot of our materials and our competition sort of formats and things like that with people in lots of different countries. We've got a big new care project at the moment, which is sharing what we've learned in kidney care in the UK with 5 different European countries, translating the courses and so on. So there's a lot of interest beginning from different parts of the world, but I would say we're probably still ahead in general. So I don't know. It's not that it's a competition.
It is the nature, I suppose, of the NHS that it's a very unique arrangement we have with our healthcare service, as opposed to the insurance-based systems of many other countries, or part insurance-based. So I guess, yes, we have a great opportunity, don't we, to lead the way and break new ground in terms of sustainable models that other countries and other places in the world might be able to replicate in their own way.
Yeah, definitely. And it is interesting, the differences between the insurance-based and other, because in some ways an insurance-based system should be more sustainable naturally, because, the insurers want people to stay healthy. They have the incentive so although we as a country want people to stay healthy, the incentives within our system actually aren't there a lot of the time. So anyway, maybe that's a different discussion, but it's really interesting to look at.
Yeah, well, we may have to come back to that as a particular topic for the show, I think, Rachel. So you might have to come back on to talk about that another time. So after 17 years of leading change across the healthcare sector, what do you think the sector has achieved so far? And what do you hope for the next 17 years? Given that this will place us right in the NHS net zero window. And we've not talked much about the Greener Initiative, but I am going to be talking to other guests about that. But how does the next 17 years look to you?
My goodness. So I can't, I can believe it's 17 years, but it still feels like there's a lot to do. Obviously, I think people recognise the importance of sustainability. I do think a lot of people in the system have already recognised that importance. I don't think anyone would deny that it's necessary that we make our system sustainable, and that actually that has connections with the wider environment, which 17 years ago was not there. And also there's a recognition that we need a lot more information and evidence on some of the detail of what our impacts are and how to change them. So the sort of detailed measurement that hasn't, that takes a long time has begun. We still need a lot more knowledge, but at the same time, I think we've started to recognise that it's not just about knowledge and information and data. It's more, maybe more importantly, about putting that knowledge into action. So, for example, I've been papers published saying about 30% of the care that we give, in different countries and different systems, but about 30% is low value. And that will mostly be in richer countries. So that means that we are, in 30% of cases, we're either doing no good with the care we give or we're actually doing some harm. And that's really interesting to me, because that's a third of everything. And, we need to look at the really obvious bits. Okay, we need new machines, we need new tech, we can go digital with lots of things. There's lots we can do to make things lower carbon. But actually, there are some really important fundamental things about, are we doing the right things? Are we giving people the right kind of care that they want? Are we prioritising? Are we throwing things, tech solutions at people at the end of their lives when they don't actually really want that? So there's some really important things to look at. We have the beginnings of integrating, I think, into some of the mainstream systems. So medical curricula, we've done work. Others are beginning to do work on integrating sustainability into how we teach people. Research that's done by industry and others, working with NICE in terms of integrating sustainability into how they, into their criteria, looking at guidelines for practice and then procurement criteria. So there's all across the system beginnings of things beginning to happen. But there's obviously a lot more to do on all that so that we have proper systems change. So I'll go back to our principles of sustainable healthcare, which we came up with and are used to guide improvements in healthcare design, delivery, and best practice. And they are prevention. So obviously promoting health, preventing disease, tackling the causes and inequalities in health and healthcare, patient empowerment and self-care, which is about empowering patients to take a greater role in managing their own health and healthcare, which is happening. Both of those things are beginning to be on the sort of list, which is really positive. A lean service delivery, which is about streamlining care systems to minimize wasteful activity. So making sure that everything we do adds value. So the low value stuff would come into that. And then low carbon alternatives. So that last one, low carbon alternatives, prioritizing treatments and technologies with lower environmental impacts, is kind of what a lot of people thinking about sustainability jump into. And there's all of the rest of that stuff, which is actually really, really important in terms of giving us proper sustainable healthcare into the future. And then I guess, I would like to see the sustainable value equation embedded in however we do things. So maximizing outcomes for populations, not just for the people who walk in the door, but for everybody who needs that healthcare, and reducing inequity, therefore, while also minimizing environmental, social, and financial impacts. Because we talk about the environment, we talk about climate change. It's just really about use of resources, and those resources are finite. We can't pretend that they're not. So, we can manufacture more money, and we worry about money maybe more because it's more immediate, but actually the environmental impacts are the ones that will be there for future generations.
I come back to something you said right at the very start of that it's true that there are great examples of pockets of real success when it comes to sustainable implementation across our healthcare services. But we're still not quite joined up, are we, in some of those solutions so that all organisations can get the benefit of it. Now, that's something that stands out very much to me. But in terms of what you were saying there, the time going forward now is really about educating and bringing people into the community of sustainable healthcare who perhaps have never really had any contact with it and who need to understand why we do the things that we do, and ensuring that we're not designing technology for the wrong reasons, as you rightly said, that we shouldn't be giving care in a way that's not going to benefit people.
Definitely. And so yes, on that sort of how we bring people in. And so for us, we haven't worked necessarily with organisations as in trusts. We've tried to work with sort of natural communities of practice in healthcare. And those are from the professional side, you call them specialties or disease areas. But, from the patient side, it's like my health. This is my health. And this is parts of my health that are being helped by different parts of the system. And I guess those cut across the organisational silos, and we need to push on both because it is a matrix. So we need trusts and the buildings people and everybody working in the infrastructure to be on board, but we also need the people who are the healthcare professionals and the patients who are going through those in terms of their healthcare journeys to understand how sustainability or how the climate and climate change will impact and is impacting their health now and in the future, but also how they can be a bit more mindful about decisions they make and choices, I suppose, about how they look after themselves and what kind of healthcare they might want in the future, and how that also has sustainability implications.
Yeah, we need society to challenge us, right? Those of us who are working in this field, we need to be challenged and asked questions as to why we choose to do things the way that we do in order to make these opportunities available to all, but also to understand really if we are going in the right direction. So actually, I put a challenge out to all the people listening to this podcast and watching this podcast. Challenge us on our viewpoints as to why sustainability is so important. Ask the questions so that we can really think about what it is we're doing. So I think that's a great point, Rachel. Thank you. And speaking of that, I wanted to flag up that the Centre for Sustainable Healthcare also runs some amazing courses, don't you, on sustainability and health. Would you like to give us a quick plug? And we'll put some of the links in the episode notes for people to take a look at. So if they want to educate themselves on this area, that they can come along and do some of the courses that you run.
Absolutely. So we've developed a range of really wonderful courses, I think, designed for all health and social care staff with an interest in sustainable practice. And some of these are available nationally on the eLearning for Health platform. They're available free for everybody. You just have to sign in. And they tend to be half-hour courses, which are kind of taster introductory courses, which I really recommend. And then we've got options for individual qualifications as well as group bookings and organisations with some tailored courses available for a range of specialties. So I think we've got about 16 or 17 courses now. So whichever part of healthcare you work in, there's probably a course there for you. And if not, ask us and we'll help to tailor one. But just to say that I think that the courses we run are sort of partly material online and they're partly workshop and discussion. And we found that workshop element is really, really important for people, because this is not just a learning facts kind of exercise. It's about engaging. It's quite a scary thing. When I first found out how bad it was, I was, as I said, I had nightmares. I was really upset, and actually sort of engaging with a group of people who can help to unpick that and help each other to really think what this means for their practice, what this means for them as a person, I think is really important. So it's not just a kind of set of slides and a lot of information. It's proper engagement with why is this important, how you can engage with it, and actually how it can improve your own life, but also the lives of your patients and others around you.
And Rachel, other than the courses, how can people get involved at a grassroots level? What sort of things can they implement in their own lives?
So a lot of what we've done is about involving people from the ground up. And so there are lots of things that people can do in their personal lives in terms of, changing where their money goes, what food they eat, how they travel, all of that. I won't go into that. That's not my area of expertise, but there are lots of organizations out there that are doing that. CSH has a couple of other things which I think are really good for engaging people. One of the networks. So we have about 30 different networks now for all sorts of different areas of healthcare, with thousands of members on, and really, really good way of asking questions. So just as you said before, what are the questions? Why is this important? Or what can I do in my particular setting? Those are the networks to connect with, to help people to learn and collaborate with others and feel positive about what they're doing. And that's all free and easy to sign up on a website. And then there's also, which I haven't mentioned yet actually, is our green space and health work. So we started the NHS Forest back in 2008 because we wanted a way of connecting people with the actual physical environment near to them, not just thinking about, carbon in the air and climate change, which felt a bit abstract. So we started a program, and it's very much about where people are. So it's about, what nature is on your doorstep. Can you plant a tree? What's the biodiversity like? And how do you connect with that? And actually, how is that affecting your health? So I think that really came out in COVID, that people really valued, nature around them, and began to really appreciate those connections between their health, mental and physical, and the natural environment. Maybe you can put a link in, but the NHS Forest is an amazing program. And we've just started a new program called Nature Rangers, which is people on NHS hospital sites who are there to connect people inside the buildings with what's going on outside. So that's patients, carers, obviously hospital staff, and also the local communities surrounding those areas with what can be really, really lovely spaces in the middle of people's communities. So that's a really, really nice other sort of positive way of people connecting with sustainability in healthcare and making those links between the environment and health.
I think that's a wonderful thing to be able to offer that kind of service and be able to provide that education to people in a way that will ease their fears, but also empower them to make decisions about their own lives as well, in terms of creating a much more environmentally sustainable healthcare society. So, Rachel, thank you very much for joining me on today's podcast. It's been a pleasure to have you, and I hope you will come back and join me in the latest episodes, and we can talk some more in depth about this subject in particular that I know is so close to your heart. So thanks very much for joining me today.
Thank you so much, Helen. It's been a real pleasure. Thank you.
Elaine, thank you for being one of my first guests on the Care Machine podcast. Now, this first episode is all about setting the scene in terms of what sustainable healthcare is all about and why it's so important. Not just to people like us in the sector, scientists and engineers and clinicians, but why it's so important to patients as well. But before we get into that, I just wanted to talk a little bit about the UK Health Alliance on Climate Change, of which you are the director. So can you tell us a little bit about how that came into being and what its purpose is?
Sure. I'm going to take you back to 2014. So in 2014, there was a really important essay published in the British Medical Journal that was written by Eric Chivian, who was one of the co-founders of the International Physicians for the Prevention of Nuclear War in 1980. That organization brought together physicians from all over the world to raise public awareness about the devastating medical and environmental consequences of nuclear war. And they did that through education, through advocacy. And they were actually awarded the Nobel Peace Prize in 1985 for the work they had
Wow.
done in raising awareness, both with policymakers and citizens, about the threat of nuclear conflict. Now, in the essay that was published in 2014, Chivian argued that comparable principles now apply to the potentially catastrophic implications of climate change, and that there is actually a responsibility of health professionals to raise awareness and to talk about it and to advocate for policies to turn around the destructive changes to the environment being caused by human behaviour that are having such devastating impacts on human health. Now, at the same time, the then Prince of Wales, now King Charles, he had established the International Sustainability Unit, and that was set up to address critical environmental challenges across a range of different sectors. But in 2015, his unit hosted a meeting of senior health leaders across the UK at Clarence House, and Prince Charles also attended that meeting. And it was at that meeting there was really intense discussion about the health impacts of climate change, how we need to go about address them. And they then agreed that there was a need for health leaders to come together to start advocating for climate mitigation policies to protect and promote health. And that's what ultimately led to the foundation of a dedicated organisation, which is the UK Health Alliance on Climate Change. It was officially launched a year later in March 2016. So next year actually will mark our 10-year anniversary since our founding. And we've grown to 54 membership organisations from 14 at that founding meeting 10 years ago. And incidentally, Hugh Montgomery, who actually was one of the leading people at that meeting at Clarence House in 2014, and he's a professor of intensive care medicine. He's a real leading voice on climate and health policies, and he's actually going to be our new chair. He's just taking over as the chair of the UK Health Alliance on Climate Change. So he'll be leading us into our 10-year anniversary as well, which is quite a nice joining it off.
That's amazing, and to have grown so rapidly in that space of time. What kind of organisations make up the umbrella organisation, if you like?
Yeah, so that very first kind of cohort of about 14 were some of the bigger medical royal colleges, Royal College of Physicians, Royal College of Nursing. And what's happened since then is we've really grown to include many more of the royal colleges, but also lots of associations and societies, which might be smaller, but they
Right.
represent specialist areas of healthcare delivery. And we cross all area of healthcare. So we've got the physicians, the surgeons, the nurses, paramedics, psychologists, psychiatrists, child health, the full range of specialists working across the health sector. And the purpose, we bring them all together with the common voice.
Yeah, that's what I was going to say. It's a great opportunity for organisations that are potentially quite small to be able to come together with that common voice, to be able to bring about change, whether that's sort of strategic at the sort of government policy level or right down into the sort of grassroots. So you've got this quite big sort of spread, haven't you, in terms of bringing all these organisations together and allowing them to have a voice.
Yeah, absolutely. And that's really important because as there are different organizations of different sizes and different levels of influence, actually different resources as well. And what's really important to us is that everyone's got kind of an equal say and an equal seat at the table to talk about these things and equal opportunities to be able to participate and make sure their voice is being heard.
Now, I suppose depending on where you come from in our sector, and you've talked there about all these wonderful organisations that come with different viewpoints, there's a nuance, isn't there, I suppose, to the perspective of what sustainable healthcare really means. So how do you define it in the context of UKHACC?
Yeah, so really good question, because I think definitions of anything can be open to interpretation.
Yeah.
So the way I look at the work of the UK Health Alliance, or UK HAC as we call it, so there's two broad areas that we focus on. One is what I would say are the health impacts of climate change and nature loss. And the other is how the health sector is contributing to greenhouse gas emissions and how we change the way we're doing things in the health sector. And the two of them are related, they overlap, but they're very distinct. So first of all, looking at the health impacts of climate change, that's around understanding and raising awareness of how these things are leading to more people entering the hospital, for example, more people falling unwell. So, for example, if we look at what happens to the human body during a heat wave, we see huge increases in hospital admissions and deaths during heat waves. It's going to worsen as temperatures rise. There's also the trauma and mental health impacts that come from things like severe storms and floodings, burns and respiratory harms from wildfires, new vector-borne diseases arriving in the UK because of the changing climate. So we need to understand those risks, we need to talk about them, and we need to find ways to prevent and protect ourselves. The second part of our work is more what I would call more the sustainable healthcare aspect. And this is specifically looking at the health sector and how the health sector itself is contributing to climate change. So the NHS, for example, produces huge volumes of greenhouse gases, which we know are making both people and the planet sick. And just looking at the greenhouse gas emissions from the NHS, the total greenhouse gas emissions are equivalent to all of the CO2 emissions from the country of Denmark. I mean, that's how massive they are. It's huge. We say it's about 5%, but actually, when you compare it like that, you get a sense of how big that is. And just like every other organization on the planet, the NHS needs to stop. It needs to stop producing so many of these greenhouse gases. So sustainable healthcare, for me then, is understanding where the delivery of healthcare is contributing to greenhouse gas emissions and identifying new ways to deliver that care in an environmentally sustainable way. And this needs to happen at every single stage of the patient care pathway in every single specialty, from the first consultation, the follow-up, the medicines, the blood tests, the surgical procedures, whatever it is, we need to look at every stage of the journey and ask, are we doing this sustainably? And if not, is there another way we could do this?
And in terms of how you get that message out to the members within your organisation, how do you roll that out? Do they take that and interpret them themselves, or is this something that you kind of all work towards as a concept?
Yeah, so what we've done is, because like I said before, there's so many different specialties, so many, and within each they'll have their own ways of delivering the care. There'll be lots of similarities, but lots of differences as well. So what we've seen and what we support our members do, so we encourage whatever specialist you're working in to develop a plan for sustainability in your specialist area. And there are some really good examples. So say, for example, the Royal College of Emergency Medicine has got the Green Emergency Department. So they've got a system where emergency departments can look at what they're doing. There are different kind of areas they can work on. And there's a gold, silver, bronze award system in place for emergency departments. Start off, you might do some things, get your bronze. There's guidance on what you need to do that's provided by the college. And in doing that, it's encouraging emergency departments. And then we see in palliative care, they've got a similar kind of thing, but it's specific to palliative care. And they've got the Green Impact for Health Toolkit to help GP practices. So there's different things in different specialties. And what the role of UK HAC is encouraging that, but also bringing them together, having these case studies, helping them to learn from each other. So it's not reinventing the wheel every single time somebody sets out to do this. So we're trying to facilitate the shared learning. What were the things that worked well? What are the things that didn't? Any advice people can share? And I think that's the role that UK HAC can play in facilitating this across all of the specialties.
Yeah, that kind of leads on to my next question, but I guess you've answered some of this already. But why do you feel sustainability needs to play such a lead role in today's health and care organisations? What is the driver, really? You've touched a little bit on the health of people, but there are other aspects, aren't there, that we need to really think about?
Yeah, there's quite a few other aspects. So, I mean, first of all, the kind of practical one is that across the UK, all of the four nations of the NHS have set targets to get to net zero. NHS England has got a target to get to net zero by 2040 for all it controls and 2045 for all it consumes. And these targets are written into the Health and Care Bill. They're also listed as a priority for the 10-year health plan for England. So from that legislative and delivery perspective, there are established targets, they're written into law, we need to do them. Right? So there's that kind of, legislative delivery perspective reason. But also more broadly, we are going through a huge transition as a country. For decades, we've relied on coal, oil and gas for our fuel. Our current way of life is powered by these fuels. But we have recognized, a bit late in the day, but we have finally, I think, recognized, and it's well established, that we need to get off these fossil fuels. And that is going to demand a transformation across all parts of society, and the health sector must be a part of this. I also think this is an incredible opportunity for our generation. We have this opportunity to transform things, and we must do it. So let's grasp it. Cleaner, more efficient, cheaper, better. These are things we can and we should aspire to do anyway, but now we've got a real imperative to do it. And we need leading, trusted voices to help lead that change. Another thing I'll say there, just on the trusted voices. So when we look at rankings, I mean, nurses are consistently ranked as the most trusted profession. They're swiftly followed by engineers and doctors. And so I think we need to lead by example, use that position of trust for good. And just finally, the other thing I'll mention is where the kind of overlap between the health impacts and the health service. So using the example of smoking, I think it's a really good example. So in the early 70s, about half the population smoked, including lots of doctors. And it was perfectly acceptable for a doctor to be smoking during consultation with the patient. Goes to your GP, doctor smoking, and doctors even promoted cigarettes. But when the health risks became really well established and accepted, it was the medical profession who were among the first to act, and hospitals were the first institutions to introduce smoking policies. Now, that was a major shift at the time, but it was instrumental in leading the way for other organizations to follow. Now, if the doctors and medical staff had continued to smoke, it would have completely undermined that message. It wouldn't have been taken seriously if the doctors were still smoking, but government was trying to implement policies. And the same applies now, I think, to climate change and sustainable healthcare. If we're saying that climate change and greenhouse gas emissions are harming people's health, then the health sector can't keep continuing saying it's a problem, but then contributing to it as well. It needs to really get its own house in order. Otherwise, it undermines the message completely.
Yeah, I absolutely agree. And as you rightly said, if we're putting out the same amount of CO2 as Denmark, then we really have something that we need to address. Over the course of this podcast series, I'm going to be unpacking the challenges about implementing sustainable practices in the NHS. And from your viewpoint and the work that UK Hack is doing, how important is it to embed this kind of sustainable thinking into our healthcare service? And is it unique to the NHS, or is this something that other healthcare providers are attempting to undertake around the world?
Yeah, so it's just critical that it's embedded and it's not an add-on, an additional thing. It needs to be embedded into everything that we do. Like I said before, it needs to be considered at every stage of the patient journey, from prevention
Yeah.
right through to recovery. And we need to be constantly asking questions about the current ways of doing things, discussing, challenging, and leading the change. And here, leadership is so important, as is education. They're two really critical things. And then the other one, money. It always often comes back to money. But too often, what we're seeing now is that sustainability and implementing sustainable policies within the healthcare, it's falling to a minority of very passionate people in an organization who are doing absolutely amazing work and are so driven. But frequently, they'll be doing that role, the sustainability role, as an add-on to their existing work. And we can't realistically embed sustainability without dedicated people and resources to deliver it who've got the time to do it. On the question of if it's unique, no. I mean, every organization has got to do this, and all healthcare providers, I think, should be looking at this. As a couple of examples, the Sustainable Healthcare Coalition is a coalition similar to ours, but while our members are health organizations, they're a coalition of more industry partners, so pharmaceutical companies, and they also look at clinical trials, and they're looking at what these can be, how they can influence carbonisation. And then, like I mentioned before, all that work with our members, the Royal Colleges, associations, societies, as well as in their specialist areas of practice. We're also looking with them at their own buildings, their own premises, if they run conferences and events, how they all need to contribute in that sense as well. So yeah, across the board, I think people are looking at this.
Certainly my community, the engineering community, are incredibly passionate about addressing the issues that they are now seeing, and particularly around medical devices and technology. As you rightly know, you can't go into a hospital from one end to the other without being touched by a medical device or a piece of equipment. All of that, we have to consider all of those aspects, don't we?
Yeah, absolutely. Everything. We need to look at it. We need to ask the question and then think, all right, can this be done a different way?
So nearly after 5 years of leading UK Hack, what do you think the sector has achieved so far, and what do you hope for in the next 5 years? I guess we're looking now for the NHS to have reached their 80% reduction by 2030. So what is there to look forward to in the next 5 years?
Yeah, so first, I'd say there's a huge amount of progress being made in the last 5 years, particularly since COP26 in Glasgow, which for me it just marked a huge shift in the momentum of the health community globally, in advocating for climate change and in really pushing forward on sustainable healthcare initiatives. So in that global sense, I mean, until recently, health was not even part of the COP meetings. It wasn't part of the agenda. COP26, there was a health pavilion. It wasn't part of the main negotiations. It was outside. But it was there, and it was a presence. And it was really the first time there was a really notable presence of health at the COP meeting. And that has evolved in subsequent COPs. Last year, COP29, it was the very first time that health made it onto the agenda of the formal negotiations. So, I mean, that's how not in the conversation health has been when it's come to climate change. But it's breaking through. So that's huge progress. And, the Global Climate and Health Alliance which we're members of. It's the kind of global version of us. They've been instrumental in driving a lot of that. What's also been instrumental and is really looked on as a global leader is the Greener NHS in England. They were instrumental again at COP26. There was a commitment made by multiple countries to build climate resilient, low carbon health systems. A lot of countries signed up to that at COP26, and Greener NHS in England was really part of leading that. Those commitments subsequently led to the establishment of the World Health Organization Alliance for Transformative Action on Climate and Health, ATACH.
Long title.
And that's to bring like nations, health sectors across different nations together to help them deliver the COP26 commitments to deliver climate resilient, low carbon health systems. So loads of work going on there. And last year at the World Health Assembly, the countries' health ministries across the world adopted a resolution on climate and health. And that was about recognizing health in climate policies and climate in health policies. And also last year, the WHO made action on climate and health a priority for its program of work. So globally, lots going on, lots of progress being made. In the UK, also lots of progress. We've got the green plans in every NHS trust in England. We've had the specialist areas I mentioned starting to look at their pathways and where they can reduce their carbon footprint. So that's all the good stuff. Now, looking what needs to happen now, because it's good, but loads more needs to happen. We're still going way too slow. So we used the word embed before, and I would see a lot. We need to see a lot more embedding of sustainability into healthcare delivery. In many ways, it does still feel like an add-on rather than integral to what we're doing. It's often put up against cost, and it's not right, because often the more sustainable way of doing something actually brings down the cost, but there seems to be this assumption that it's not, and we really need to get over that and start thinking about it more positively. So I think that needs to happen. There needs to be a big shift in education for health professionals. We're starting to see a sustainable healthcare built into the medical curriculum, for example, an undergraduate curriculum. But we've so many people working in health that graduated years ago and have never had training on this. And so we really need to think about how we're supporting those people and how we're educating that community. The government needs to play a role here. In England, they've published the 10-year health plan for England. It's got this focus on sickness to prevention, on hospital to community, on analog to digital. Those three things, prevention, community, and digital. I mean, sustainability is integral to every one of those. If they're done properly, they can bring improvements to health and the environment. And then the final thing I will say, where we've really been very lax, we've focused on net zero. We've got a target, and it's great, and targets are good because you can measure them and you can see how well you're doing, and so there's something you can grasp. But what we've really kind of not addressed is adaptation and resilience, and we've been very slow about it. And we're now in a situation where things are already pretty bad. So there's an urgent need to address the resilience of the health sector. So we just this year, and this is fresh in my mind because in June this year, we published a report, and it was looking at the current vulnerabilities of the health system in the UK to climate impacts. So we're already seeing, well, we already know we've got heat waves, we've got storms, we've flooding, we've new diseases, and the health system isn't equipped to cope with them. And the consequence of that is we have hospitals that are overheating. We have surgeries being cancelled. We have ambulances not being able to reach people because of flooding. We have staff being expected to work in really difficult, uncomfortable conditions. So we're way behind here. The NHS has already got a massive backlog bill, a maintenance bill. And every
Yeah.
time an extreme event happens and the system is affected, it actually adds to that bill. So we really need to get on top of it. And there's a lot of work there, and that needs money, and it needs commitment from the government. It needs ring-fenced funding to get our health system up to scratch, so it's resilient to the threats that are happening now. I mean, never mind 10 years down the line, we need to be making
Yeah.
sure we're protecting ourselves. So that's really important that that's addressed.
Well, I mean, coming back to what you said right at the start there, it seems ludicrous to think that it's only recently that the healthcare community has got a seat at the table at COP, which just seems quite bizarre to me, I suppose, and to you and most people working in this space, that we've only been seeing it as a one-way street for so long. Oh, well, the healthcare service will make sure people are better, that they're suffering from these things. But what we're actually having to say is, no, we're compounding some of that. We have to have a seat at the table to ensure that we're not contributing to what is already a crisis. And you're absolutely right. We're already in a climate crisis. It's not whether or not we're going to have climate change. It's already here.
Yeah.
We're seeing that globally. So being able to ensure that we can create resilience, not just within society, but in our healthcare services themselves, that's really vitally important, isn't it, going forward?
It is. And what I would say is, as well, that bit about addressing or compounding the issue for the health sector and needing to address that, they're also the front line of it. So if we use a heat wave, for example, we know that during heat waves, more people are falling ill. It's increasing the risk of things like stroke and cardiovascular disease. People are already vulnerable. We see those increased deaths. So there's an increased number of people arriving at the hospital. But at the same time, we have hospitals that are overheating. We have stress. We have staff who are working in these conditions that are, too hot. So it's kind of coming from both sides, and it's the opposite of a win-win. It was, you've got more people coming in the door, and your system is collapsing at the same time. So it's really critical that both sides of this are, well, all sides. It's making sure fewer people are falling ill, make sure the NHS or the health system is not contributing to greenhouse gas emissions. And when these things happen, that the NHS, the health sector, is able to cope with them. So they're the three things that we need to be ready for.
Well, thinking on that then, there are a lot of people who are watching and listening to this podcast who will be working in the NHS. And you talk there about their contribution. What sort of things can we get them involved in to help make sustainable changes in their workplaces?
So what I'd say is it's so vast and so varied. So whatever the area of work you're in, I would say find out what's happening. There's lots of information, there's lots of resources available to people. You might find actually there's nothing happening here, so maybe I could start something. So there's lots of places to look. So our website, we've got a number of policy reports that lay out the evidence across different sectors and how they're impacting on human health. So fossil fuels, food, biodiversity. And then we also have the specific health sector reports. So we've got one on decarbonising surgical care pathways. And we've got that one I just mentioned on building a climate resilient health system. And then there's organisations like the Centre for Sustainable Healthcare, which is an extremely valuable source for education and resources related to delivery. There's the WHO Alliance for Transformative Action on Climate and Health, and they've got case studies and reports from health sectors around the world, so you can see and learn from what others are doing. So I'd say find out what's happening in your specific area, question the way you're doing things now, ask, is there a more sustainable way to achieve the same or even a better outcome? And don't hold back from suggesting improvements. If you're not familiar with your NHS Trust Green Plan, risk assessments, seek them out, find out what's happening, feed into them. And then the other thing is being part of the bigger movement. There's a huge community of people out there who have this interest and are wanting to play a part. And everyone plays their part in different ways, and we all have our strengths, and we can all play to those strengths and find out where our place is. So there's lots of opportunities always coming up to like have your say, get involved in campaigns, respond to consultations, and building your knowledge. So I'll put a plug in here, if that's okay, for our newsletter.
Yeah, totally.
So our
Yeah.
newsletter comes out, it's like the middle Friday of every month, and it's really well received. So in that, we will always highlight, you know, what are the opportunities, what campaigns are happening, what consultations are open, and it's all there for people to look at every month, like, and see, oh, where can, you know, what events are on. So we're happy to promote stuff in that, and we'll share it out. And I can give you the link afterwards if you want to share it for people to sign
Yeah,
up.
absolutely. We'll put any links and things that you've mentioned today, we'll put those into the notes for the episode. So if you click on the notes below, you'll be able to find those all those links that we've talked about today. Well, Elaine, I can't thank you enough for coming on my first podcast. It really has been a pleasure to have you and to find out more about what UK Hack are doing and the bigger picture in terms of sustainability. So thanks for setting the scene for us today.
Thank you, and it's been a pleasure. Thanks for having me.